Hi, welcome back to Reclaim the Pause. I'm your host, Lindsay. Today I'm excited to be speaking with Dr. Alexandra Gajer, who is a board certified physician and founder of the Gajer Practice, where she specializes in helping women optimize their health through metabolic medicine, hormone balance, and innovative peptide therapies. She combines cutting edge diagnostics with evidence based protocols to help women reclaim their energy, restore hormone harmony, and achieve lasting metabolic transformation. Her personalized approach has helped thousands of women break free from stubborn weight gain, fatigue, hormone imbalance, to feel vibrant and powerful in their own bodies again. Welcome to the show, Alex.
Thank you so much. Thanks for having me.
Yeah, I'm excited. So I just love to hear some of your history and origin stories when I speak with people because I think it helps women really relate to why you're in this work. So you told me that during your second year of residency, you contracted Lyme's disease, and it really changed the course of your life. Can you tell us more about that time and how it led into working in metabolic medicine and hormone balance with women?
Yeah, absolutely. Yeah, so I went through conventional medical training. I went to medical school at University of Maryland. I took some time choosing my specialty, and eventually I decided on emergency medicine. I really liked the pace. I liked being at ground zero where everything was happening and you got to sort of be there for people. I felt like in a real way and make a difference. Um And my first year of residency was very, very intense, as it should be. We work 80-hour weeks. We work under pretty hard conditions. But I was still loving it. I was learning a lot. I finally felt like I was sort of getting proficient in a number of things. And the summer after my first year, or during that time, I went on a hike in Vermont with my family. I came back and I had some strange symptoms, and it started on a period of time where um, I got pretty sick. And it started for me as really severe headaches. I went to see my doctors. I talked to my colleagues. Um, Nobody could really figure out what it was. I just kept getting worse with more neurologic symptoms, eventually, a lot of fatigue, aches, and pains, and real difficulty in continuing my work. And eventually, I was diagnosed with Lyme disease and went through the treatment and got quite a bit better. Um, but I found that it only got me so far. And I became really interested. I felt like I was no longer sick. Like this was no longer, um, I wasn't in that really sick state. But started becoming really curious about how do we create a state of health? I just didn't feel like I used to feel. I felt like my energy wasn't where it should be. My sleep wasn't where it should be. And my interest, and also I was working with a lot of patients who we could sort of slap band-aids on their problems and get them better enough. But my real passion became, how do we create this state of health? And that sort of led me to my journey working with metabolic health and hormone health and inflammation and really working in this realm of health optimization in helping people really feel their best at any stage of their lives. And I've especially loved working with women in perimenopause and menopause. And it's such a powerful transition, and it could be a transition where we feel we are no longer living in the same body that we used to. And I think that we now have a lot of tools in medicine where we can restore health. We know, medicine is not just about curing or preventing disease or doing surgeries. We can actually do a lot to create a state of health in our bodies.
Yeah, that's a powerful story where your health was almost taken away from you and it changed the way you viewed medicine and how you were working as not just kind of getting people where they're not symptomatic, but they're not actually in a place of optimized health or where they feel amazing. And like, what does that look like? How do you get people there? How do you look at root cause medicine and really start, helping people live in vitality as opposed to just kind of surviving. Well, I feel good enough. Well, that's sometimes not enough. And it's true, Lyme disease and other tick-borne illnesses can mimic some of what goes on in perimenopause and menopause as far as the fatigue goes. I also have Lyme
Hmm.
disease and ehrlichiosis, two tick-borne illnesses. Mine were discovered much later. And so it's quite the journey when you go through that.
Yeah.
And it also feels a lot like perimenopause where it's isolating. No one's
Hmm.
really going what or knows what you're going through. No one really has an understanding, or maybe they think, oh yeah, she's kind of a hypochondriac. We're all busy. Or maybe for you, we're
Hmm.
all residents. We're all doing the same thing.
Yeah.
And so I think that's such an interesting correlation to the work that you do now with really supporting women.
Yeah, absolutely.
Yeah. So I just want to talk a little bit about what you do. You have something called peptide therapy. Can you talk
Hmm.
to our listeners about what that is and how it helps balance hormones or affect the metabolic system?
Yes,
Yeah.
absolutely. So, I think what I do now is very much individualized and it depends on the person who comes through the door. I do meet a lot of people, both men and women, who are struggling with weight as a starting point. Sometimes it can be, but the weight is usually the tip of the iceberg. There's the
Yeah.
weight, but there's also the lack of energy, the not feeling quite right, the not being able to do things that you want to do. Holding on to extra fat can be very inflammatory. So I do think that metabolic health is sort of a foundation for a lot of our other processes that happen within the body, and metabolic health is really about how we use food for fuel, and whether we store the food we eat as fat or whether we burn it for energy. And there's a range of healthy weights that people can be, but people feel their best when metabolic health is optimized. So that's often the starting point for me with people, is to understand how your body is using fuel and energy. And I do lab work and also just talk to people, and we look into insulin resistance, because if you're somebody who is genetically predisposed to being insulin resistant, there may be different strategies for you to feel better, and we need to really work on blood sugar management, whether that's looking at a CGM or doing something like making sure you take a 10-minute walk after big meals, because that actually brings sugar into your muscles and counteracts some of that insulin resistance. So I try to build a good foundation for metabolic health for most people. And then we sort of look at hormone health, which especially um, as women, perimenopause can start as early as 35, and it can look like a lot of different things. And it can look like stubborn weight, it can look like low energy, it can look like I'm going crazy, it can look like, even inflammation, autoimmunity, disrupted sleep, sex drive, not the same exercise capacity that you used to have. So, um, early on, I like to help women get an idea of where their hormones are, do the testing. And a lot of times in that perimenopause period, there is quite a roller coaster of estrogen going up and down and moods, and it's a wild time. So we use various strategies to help women just feel a little bit more in control during that time, whether it's using bioidentical hormones or the right supplements and nutrition and exercise to help women feel more balanced. Um, Peptide therapy is sort of a newer, more innovative type of therapy. And, we all kind of know about hormones. We know that we have our reproductive period from puberty until we go into menopause, where hormones are kind of optimized for us to reproduce. And then, for most of human history, humans were only alive for about 45 years. So we reproduced and we died. But now we're alive much longer, and it's a little bit of a chaotic time period. So we know that hormones decline at that time. But peptides are also something that's made in our body, and they are chemical messengers that also govern different processes that we've been talking about. And they also decline after we go through menopause. And that shows up as something different for different people. So sometimes supplementing with peptides can be really helpful to restore balance. And we can talk about it in a little bit more detail about what they are, how they work. But there are different types of peptides. They're in a few different categories. There are peptides for body composition and weight, muscle mass. There are peptides for brain health that can help with focus and making sure that our brains are aging in a positive way and can help with anxiety as well. There are mitochondrial peptides. So, our mitochondria are the powerhouse of the cell, and they're really important for so many different functions. And sometimes using some of those peptides for very short periods of time can just upgrade how everything else is working. There are peptides for inflammation and pain. So there's a number of categories, but that's sort of the general landscape of how we kind of enter this world.
That's so interesting. I love that your inroad is really, starting in that almost inflammatory state where people are dealing with weight and we know even just losing 2.5 pounds in perimenopause can reduce those inflammatory factors and help insulin resistance. And so it's like such a great inroad to just help people feel better initially, even if it's not gonna like say quote unquote fix, but just to start to feel better so then you can take more action and maybe improve your diet or do that walk, right? To get, glucose in the cell and all those things. I really think that's an amazing approach for people and really starting at their main pain point, which, like you said, is kind of the tip of the iceberg. Because I see tons of women who are like, energy is my main thing. I also want to lose 5 to 10, 50, or 15 to 20 pounds, depending on where they are. But it's always that inroad
Mhm.
of like, I'm just exhausted and I've got this weight. And so working those two things together is so powerful. And peptide therapy isn't something that as a functional nutritionist, I think of like, okay, when we're eating proteins, we're breaking proteins down into peptides. But as we age, that function becomes harder, right? We're not doing that at maybe a rate that is benefiting us. And so you're kind of saying if we can start supplementing with these peptides in certain areas where maybe your testing shows or through symptoms, you can say, oh my gosh, this person is really dealing with a low energy and we need to mine the mitochondria, if you will, and really support mitochondria. We're going to go in that avenue. Or you can take a combination of maybe peptide supplements and start helping women feel better sooner. So is that really the idea behind that, is to give the body what it maybe can't make as fast as it used to?
That's exactly right. Yes. So right, just like we make hormones and our cells make hormones, some cells make peptides as well. And it's
Yeah.
just the whole process is down regulated as we get older. So they are just short chains of amino acids. The
Yeah.
thing the good thing about them is that unlike medications, which have to be broken down, which usually you take, there's something foreign, then they have to be broken down by your liver or your kidneys, and there's sort of toxic byproducts that your body has to deal with. Peptides are just broken down to the amino acids and sort of digested like food. And I love what you said because I think that, some people want to follow an all natural approach. Some people are like, give me all the things, let's get started. But I do think that there's a balance. And there are some women that I meet who are so tired and they're so sort of burned out that like they don't have the energy to do the things they need to do to feel better. They don't have the energy to meal prep, they don't have energy to think about their food. They're so burned out that they don't have the willpower to stop scrolling. You know what I mean? And we get into this cycle of feeling really bad about ourselves. Um and I meet a lot of women there who are just so down on themselves for all the bad habits. But sometimes when we can give women a little bit of hormonal support or peptide support, all of a sudden you find that you are resourced enough to make some better choices. So I think the good lifestyle choices are incredibly important. And I tell people if you're planning to sit on the couch and watch TV all day, do not waste your money on any of this. This is not worth it. But if you are motivated to make lifestyle choices that are going to benefit your body, this can really sort of amplify how your body responds to those positive inputs and again just give you back something that your body needs to thrive. And sometimes we just need we don't know that we're missing that biochemical support to be able to do some of the things that we need to do to take care of ourselves.
It's so true. One of the main things I deal with women is shame. And I think in my view, when I see women stuck down in this shame, is those are the women who are the most motivated, who are paralyzed by symptoms, by fatigue and brain fog and that monkey kind of crazy brain and like, am I crazy? And they start self-isolating and really it can lead to, like you said, poor lifestyle habits that we get stuck in, and then shame builds more and more and more. And really, with the work that you do and that I do, it's about kind of saying, hey, we can turn the ship by doing one small thing. And whether, like you said,
Hmm.
it's BHRT, maybe some women want to go right there, but we know if that women don't have a good soil to start with, like they've been eating poor and they have bad habits, HRT can start to turn the ship, but then it might be able to turn it enough that you can start those lifestyle habits. Or women who want to go naturally, maybe getting some peptides on board or getting their metabolic health under control, that can start to turn the ship. And then they can decide, well, maybe if I want to do more medicine, go in and get on some HRT, or I want to look at these lifestyle factors. What's one thing I can do? So there's lots of different ways to break that shame and say, hey, you're not alone. Women are dealing with this. All women, if we're lucky, are going to go through this transition. As you said, we're living longer. And so we can take it from this place of shame into a place of empowerment. Like, I now have the tools. I'm working with Dr. Alex, and I now have some tools to actually start to feel better and break up that shame and then that response that comes from that, and that self-hate that just builds up, and it's almost like, oh my gosh, what do I do next? So I really like hearing that. And I think as a nutritionist and health coach, I love hearing like, you can go in and peptides, you could go in and HRT, you can start lifestyle factors, you can do all these different things. You're not set, because I think some, doctors are working just in medications, antidepressants and BHRT, and they're not really providing support in other ways. And so women can only go so far, feel like what you said in the beginning. Like, you feel a little better, you're better, but you're not working from a place of optimization where it's like you're thriving in your life. You have joy again, you have purpose, or maybe it's just libido or whatever, you're dealing with.
Yes, I think that doing both is just so important that
Yeah.
the meds, the supplements, all those things, they're kind of icing on the cake, and they may they're there so that you can do all these other things, but like you talked about, the exercise, the food, the nutrition, that's
Yeah.
the real fountain of youth, and that's where real longevity and vitality comes from. So yeah, there's definitely
Yeah.
a balanced approach, I think.
Definitely. So, when you're working with women who are coming to you, particularly in perimenopause and in this menopause transition, what do you think their biggest barrier is to either getting help or starting to feel better? Like, what's holding women back? What's standing in their way, just from your perspective and in your practice?
Yeah, I think that women for a long time have been told that it's normal to feel terrible, you know? And we're kind of conditioned to put ourselves last. So I work with a lot of busy women who are maybe in a place with their career and their family life where they're doing a lot. But I do think that this perimenopause period sometimes is a turning point where it's like, no, enough doing everything for everybody else. Or I think a lot of women get to this point of like, what is this all for? I'm putting all this energy out at my job. I'm feeling kind of burned out. I don't feel good in my body. So I think that, in some ways we're kind of conditioned to think that this is just what life is like. And um but more women are talking. I love that you're talking about this. Women are talking everywhere, and that this is not normal, and that we can actually get this time period back, and we can really um have this be a little bit of a revolution in our lives, have this be a time where we reclaim the things that are really important to us. And I see a lot of women, come in kind of beat up by the world and then start doing these things to take care of their bodies and start feeling better and really step into like the brightest versions of themselves, which is just the most incredible thing to watch.
Yeah. I think you're right. For so long, the barrier has been that there's no expectation for what perimenopause is going to be. And
Hmm.
particularly for me, I started perimenopause in my mid 30s, and it was like a hurricane hit me, and nobody knew what was going on. I had no idea that perimenopause was even on the table for me. And of course, 1 in 3 women have an autoimmune condition or disease. I have multiple autoimmune conditions and other disorders. And we know that women in that place can deal with perimenopause at more intense rates and our toxic society. So I think one, it's not really talked about. So women aren't prepared. And then when they do get into it, it's kind of like maybe in generations past where it's like, well, everyone goes through it, deal with it. I got a lot of this, like, too bad about your luck, and it was
Right.
kind of like, whoa. And now moving into this place, like you said, where women are talking more about it, and I think it's becoming more well known, and people actually know what the term perimenopause is, not just menopause, or like menopause is 1 day and then I don't have my period and it's awesome. And it's like, no, actually, that's
Mhm.
not anything like what it is. So I think that has been a big barrier, just knowledge, just that the unexpected happens and you don't know what to do, and then seeking out quality providers who are willing
Right.
to really work in all these different avenues, not just one area or just band-aid medicine, but really saying, oh, looking at that person individually and understanding where they're coming from, allowing them to be seen, and then moving them forward in the direction that they want to go. And like you said, this is can be an amazing empowered time. We don't have to be victims to to the transition. Yeah, so I really love the work you're doing.
Thank you.
Yeah. So to close, I love to do my signature questions. So in my business, I work in 3 pillars of health: physical nutrition, emotional system regulation, and spiritual connection. And I just love to get insight on what women are doing personally. So if there's a woman listening who's really suffering, they know that there's a lot of different ways to get to the same point, right? We can use
Hmm.
personalized medicine and these thoughts of like what worked for someone else might not work for me, but this could work. And so if our listeners are saying, I've tried everything and nothing's worked, maybe this will help you feel like you're not alone. So what's one way you're currently nourishing your body, either through food, movement, or rest?
Yeah, great question. I said all of the above. I
Right?
feel like I have to do a lot to keep my body running the way I want it. I focus on protein when I eat, try to get and try, and I fall short all the time, guys, but I try to get somewhere around 30 grams of protein per meal. Try to make sure that I'm eating whole foods mostly, that I'm nourishing my gut microbiome, and I'm eating multicolored vegetables, and I'm, kind of on a nutrient hunt when I'm eating so that I make sure that my body gets everything it needs. And I'm absolutely very committed to rest and making sure that I get enough sleep and exercise. I have a Peloton bike that I love. I go on walks most days. I do strength training. I do yoga, and all that is really important for my health.
Yeah, that's awesome. And I think sometimes it's hard to think about when women are in a place of suffering of doing all those things. But once it becomes habitual and almost a super habit and part of your life, then it becomes easier. You start feeling better. You can see the connection between movement and reduced hot flashes and eating whole foods and like less puffiness, that weird menopause puffiness. And it's like, removing some of those, toxic foods from our diet can be really supportive. So thank you for that. So when
Mhm.
life feels overwhelming, what's something that helps you reset emotionally or calm your nervous system down so you can make good decisions?
Yeah, another great question. And I think, the first thing that comes to mind is just having support around me. I think, especially as doctors, we are often put ourselves last, or our caregivers in big ways. And I think the last several years, I've been much more focused on having friends, having that social outlet, and I've noticed how much of a difference it makes just to, um, take breaks from work and spend time with people who lift my energy. I think that's really important for managing stress. I'm also someone, I'm a big believer in meditation. I meditate every day, and that is big for emotional regulation for me, as well as yoga and exercise. I think all those things are really important. I think just, we think a lot about what we're putting into our physical bodies, but I think in terms of emotional regulation, at this stage of life, I'm much more focused on what do I allow into my consciousness. And I'm careful about what I'm watching, who I'm spending time with, and what kind of images and information is coming into my brain and my body to help it thrive.
Yeah, right on. That's so true. And I love that you bring in that community aspect. There's some current research out that's showing that women who reach out and connect with friends and someone that you have, a likeness to can reduce depression by 50%, even a 10-minute phone call, whether you can meet in
Hmm.
person or not. And I think there's something so powerful about that. And I too also limit what I allow into my visual, social media and news. It can really impact the brain. And I think new studies are showing that it's hurting the brain as much as drug addiction, like short videos. And it's like this instant gratification or these dopamine hits, and it really messes with sleep and all these things. So really protecting that and having good boundaries is so important. So I absolutely love hearing that. And of course, meditation, one of my absolute favorites for calming the nervous system down and like, okay, wait, everything's fine, everything's normal, because it's like a pattern interrupt, right? Um,
Hmm.
so lastly, what's been grounding or nourishing you spiritually lately? So this could be faith if you're faith-based, it could be nature, creativity, the universe, or something else. Give us some insight on
Hmm.
what that might look like for you.
Yeah, and that is actually very important for me too. And I think it is different for each person, of course. And I think my spiritual connection is more within yoga and meditation and slowing down and um, finding those places of connection. I think especially in meditation, and I spend a good amount of time reading. I'm also part of a meditation group that's very nourishing. That's here in my area. But for me in particular, that is something that kind of nourishes my soul and makes me feel connected to something greater, which I think is so important. We talk about all these other things, but purpose and feeling connected to something bigger, however women find that, is really crucial for our well-being.
Yeah, it is so crucial, and I look at this as more than spiritual connection as in resilience. So if we can build those connections and look to our greater purpose or a higher power or something like that. And I think whenever we go over this area, it's all intertwined. So it's hard to say what's emotional system regulation, what's spiritual connection, because we know, well, physical activity helps us feel emotionally better and gives us the ability to maybe be more connected spiritually, right? And so it's like all of these really work, but this in particular is an area that most women don't think about when they feel flat and they feel like they don't have a purpose or what am I doing? Go, 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 go. And then you hit that burnout and you just feel like I don't have the energy to do anything. What is the point of all this? And so reconnecting spiritually can not only help us manage stress, but also build resilience to stress, which is like, I know for you as a
Hmm.
doctor and like busy schedules, it's like we need to have resilience, not just that we're managing it, but that we're able to say, like, I am resilient to what's coming at me because some days it's like you're drinking from a fire hose, like, holy cow, what am I going to do to reset here? And so I love that you have that connection and that you're in an area where you can seek that out. Sometimes we self-isolate and it's like, well, what is it? What is it that we can find that's going to help us feel more connected? What community or tribe is going to help us kind of
Hmm.
move the needle forward and start feeling better? So thank you for
Yeah.
sharing what you're doing because I think that's so important.
Yeah, thank you. Thanks for asking.
Yeah. So if a woman who's listening really connects with you, where can they reach out? Like, how can they find you, or what resources might you have for them?
Yeah, so I think the best way to find us is the website, which is thegajerpractice.com. That's spelled Gajer. And we have an option there to book a free introductory call, which I think is wonderful. It's just a way to talk to our staff. We're super tuned into what women are going through right now and just explore whether working with us would work for you. We can work with people across the whole United States in different capacities. So, that's a wonderful way to find us. We're on Instagram at the Gaia Practice. And yeah,
Awesome. So I will have that in the show notes for anyone who wants to click on that and reach out to Alex and see, what she can do to help you start feeling better. So thank you so much for being here today.
thank you for having me.
Yeah.